I don't think there's meaning to life anymore. What if I just off myself and get done with it?
Here, please get serious and eat your food. You haven't slept well these past few days. Now, you don't have the energy to eat? How can you take your medicine if you don't eat?
There's no point in trying. Don't bother me.
This is Mariano and Dolores Guzman, married for 35 years but staying at a retirement home. Mariano is diagnosed with diabetes, a heart disease, and several kidney problems, which requires him to have a dialysis twice a week.
Mr. Guzman, it's not proper to skip meals while in treatment, especially since you haven't been well these days. I really advise that you go check in with your doctor.
No, that's not necessary. I just want to be left in peace. That's all.
You can't even take care of yourself properly, dear. Nurse Isabella here has a very hard job of assisting you when bathing and during your walks.
He's also very hard-headed. You know that? But can you at least take your medicine, Mr. Guzman?
Alright, but just for 2 weeks. Those things mess up my state of mind.
Few days later, Mr. Guzman's condition continued to decline. He is often groggy, sleepless, and he lost interest in things that he used to enjoy, such as watching his favorite TV show, Encanto.
Hey, old man. How have you been? Haven't seen you around these days.
I just want to be left alone, Bruno.
See? I know your heart's in no condition to keep trying, brother. But you need to. You have your wife. You have a child. You are one lucky person compared to me.
I don't know. Honestly, it's a miracle I'm still here.
Mr. Guzman, you have a phone call.
I'm not expecting anything today. Go away.
You might want to answer this. Maribel's calling.
Please call me this time.
Hey, Dad. How are you? You haven't been smoking, are you?
These days, it takes too much energy to even light one. But I'm barely hanging. How have you been?
Well, as you know already, work's always stressful. But listen, Dad, I know now's not the right time and you hate whining, but you really need to see a doctor. Mom's always worried sick in case you didn't know.
Mirabel, Mija, I'm dying. There's no point in trying to recover from this. Let me be.
Please, Dad. Just this once. You might even recover from this.
Yeah, alright. Just once and no more. What is it for me, though?
I'll be visiting you next week, okay? Aren't you at least excited to see me and your grandchild? Mariano agreed to continue his medications and the whole family decided to let him see a doctor for a proper diagnosis.
Hello, Mr. and Mrs. Guzman. How are you both?
As you can see, I'm not doing great, Doc.
I've noticed that you have changed. You have lost a lot of weight.
Yes, Doc. Because he usually skips meals and always finds the reasons not to take medicine. What do you think is wrong, Doc?
So based on my assessment and observations, while also considering your medical history, you are diagnosed with major depression. As I have noted some signs and symptoms, such as your wife reporting sleeping problems, often lethargic, change in weight, and suicidal thoughts after a series of checkups.
What should we do, Doc? I'm really worried about him and scared of what he'll do.
I'll be prescribing medication for the mood disorder and come back here after 2 weeks so I can check if your condition has improved. Mr. Guzman, you will be taking this every day, okay? And Miss Dolores, please make sure that he is taking his medicines.
Did you hear that, dear?
Okay, fine. But I'm only doing this because Mirabel said so.
2 weeks have passed, but Mariano's condition has not improved. Until the day came when he suffered a heart attack and was rushed to the hospital for immediate treatment. Renal dialysis is necessary to keep him alive, at least until it's clear whether the heart and kidneys will recover.
Hi, my name is Julieta, and I'm the nurse in charge today. So I'm here to inform you about the physician's orders for Mr. Mariano Guzman's case. So Dr. Antonio Madrigal recommended that the patient will increase the frequency of renal dialysis 3 times a week.
So this will require us to move him 3 times a week from our home to the dialysis unit?
Yes, Miss Dolores. That is necessary because of his condition. His heart is damaged so severely it can't pump enough blood to keep the kidneys working.
I'll consult with my husband first if he's strong enough to talk, and I'll talk with my daughter to make necessary decisions.
Mariano underwent his second treatment and renal dialysis in order to keep his body systems functioning.
Nurse! Doc! Someone! Take this off me! I don't want to continue with this anymore. Just let me die!
Sir, I'm Nurse Peppa. Please calm down. The procedure is not yet done. You will hurt yourself if you do this.
Please, I don't want to proceed.
Sir, I request that you don't remove these tubes on your own, or else it will have a major consequence later.
Well, I don't care, nurse.
Please contact Dr. Madrigal to room 1A stat. Thank you.
What's happening? Mariano, you can stop this treatment. This is keeping you alive.
I'm dying, so what's the point of living? Just take these things off me.
Mr. Guzman, please, don't make rash decisions because you're in no condition to do so.
You can't make decisions for me.
But dear...
No, Dolores. After this, I'm done.
Because Mariano was suicidal before his heart attack, no one was sure whether his refusal of dialysis represented an authentic exercise of his right to stop life-saving treatment. On the other hand, if the doctor continued dialysis, he would be denying Mariano the same right to refuse treatment that another patient who was not depressed would have. This poses a dilemma for both the doctors and the healthcare team. Mariano's doctor called him to visit his clinic for an important matter. He continued to refuse treatment from his physician, but his wife and daughter insisted on him for further consultation.
Good to see you here, Mr. Guzman.
Why am I here again, Doc?
I called you because I had a discussion with your psychiatrist. We decided to continue your antidepressant medication to see if it would start to take effect. That is, if you would change your mind about the treatment.
My decision still remains the same, Doc. I would still arrive at a same fate in whatever decision I make. Death.
Dear, don't start...
Couldn't you agree with me just this once? You're a doctor. You should follow what your patients wish, right?
Treatments could work, sir, if you also believe that it will work. Although if you ever change your mind, please tell me ahead. Thank you.
5 weeks have passed and Mariano's condition got worse than before. He even began to refuse medications and food.
Good day, Ma'am Dolores. I would like to ask for your consent in attaching a feeding tube to Mr. Guzman, as he refuses to eat and has no energy to chew his food, so the doctor ordered tube feeding for him.
I could not decide this on my own, nurse. Let me discuss this with my family first.
No problem, ma'am. I'll be at the station when you need me, okay?
On conferring with the rest of the family, Mariano's wife denied the doctor's request.
I'm sorry for telling this nurse, Julieta, but we might refuse the feeding tube. He really doesn't want to. We have been encouraging him because it's his for own good, but he firmly refused.
What's the point of having all this talk? I don't want to burden my family anymore, because it's going to end in the same result.
Mariano's unchanged physical condition indicated that if he survived the discharge, he would probably need continuous nursing home care, a fate he had resisted even before his depression. His decision to halt treatment was based on his continuous behavior. Thus, the doctor discussed options with the family.
Mrs. Guzman, may I speak to you for a moment? As I have observed, your husband has been consistently refusing treatments that we give to him, and his body doesn't cooperate well anymore. I think it's time for us to put him in comfort measures and take him off from dialysis treatment. However, if he will still want to continue this kind of setup, he will probably need a nursing home care, which he firmly resisted even before his depression. The decision is up to you.
After much deliberation by the family, they decided to halt the treatment of Mariano and spend the remaining bittersweet days with him. 6 days later, Mariano died.
Mrs. Guzman, I'm sorry for your loss. We did everything for your husband's recovery, but I hope you find comfort and peace after this circumstance.
Mom? Hold on, are you crying? What's wrong?
Your dad.
I don't understand anything, Mom.
He's gone, Mija. Your father is gone.